Hi, everybody. Um, I want to thank the California Healthy Nail Salon Collaborative for inviting our research team to present at this meeting and learn from community-based organization research best practices and also priorities as expressed by our community members. So what Dr. Guat said yesterday about us standing on the shoulders of giants really resonated with me because when I was a graduate student, I was interested in nail salon research. Um, and a lot of them were published by Dr. Tu Watts and groups from the Healthy Nail Salon California nail salon collaborative because my mother is a veteran nail salon worker for over 20 years, and some of the symptoms that were documented in the research are things that she experienced every day. And so now that I'm sort of in the position where I can actually do something, working with community-based organizations on nail issues is a big part of my research portfolio at Drexel University. And so today we will be sharing a project that we collaborated with VietLead, a local community-based organization serving the Vietnamese community in Philadelphia uh, and so um, for this pilot research project, we have two main objectives. One is to work with a community partner to co-develop an occupational health training program for Vietnamese nail salon workers and owners in Philadelphia. And then we would like to pilot the program with 12 salons and try to understand what works and what did not work and what does not work. And so our community-based research is a very labor-intensive type of research that requires bilingual staff from the community to be on the research team, as well as staff from the community partner who holds a wealth of knowledge of the community that they serve. So we are very lucky that VietLead agreed to be our partner. And so and now I will have Emily from VietLead to talk a little bit about their organization and then their experiences with recruiting and some of the challenges working on this project with us. Emily?
Hello, everyone. My name is Emily Tran. I'm calling from Philadelphia, Pennsylvania, and I manage VietLead's health team on the Philly side. So for those of you that don't know, VietLead is a community organization working in Philadelphia and South Jersey. We have a variety of different programs spanning from youth work to garden work, to anti-deportation work, to civic empowerment work. And the work that I am involved in is the health justice work. So we primarily help folks in the community with public benefits applications and healthcare navigation and access. And how we have kind of moved into the nail salon space is, number one, just by virtue of the fact that many of the people that we are helping are elders and adults, and the vast majority of them are nail salon or other low-wage workers. And so this kind of all kicked into gear for us during COVID, when we started providing a lot of different services to a lot of different people. Because of the general inaccessibility of public benefits during this time, we had a lot more people coming to us and bringing with them also issues that they had named in their places of employment, and many of those were in nail salons. I will also say that our work during this time helped us to build a lot of really strong relationships with nail salon folks. And this programming that we did during COVID helped us build a lot of trust that really set the stage for our role in this project. And so with this project, we helped Dr. Huynh recruit nail salons for the program. We carried out the interventions in Viet at the nail salons, and we have been doing follow-up in this last few months to check up and gauge how folks are responding to the training, what changes still need to be made structurally so that they can implement learnings and findings from the training, and thinking about like broader next steps. And so what we have really appreciated about working with Dr. Huynh is that she really understands the importance of working in the community, just because in our work doing recruitment, one of our biggest challenges, well, that was actually one of our biggest challenges. And it was truly because of the trust of our staff members, and the relationships that they have built with folks that we have been able to recruit successfully 12 nail salons. I think we talked to like 50 nail salon workers and owners or something before we were able to recruit our final 12 to participate in this project. And so some really big challenges that we were anticipating, interestingly, was that as Dr. Huynh will detail later, there is a part of the project that folks will have to do air and urine sampling, and that was something that we anticipated would be a really big issue. But actually the biggest issue for a lot of folks was time, is that they didn't have time to do the training. The nail salons were going through, we tried to time our recruitment such that it would be during like a slower time in the nail salon, ending like right before summer when it would be a really busy season for folks. And so that was a really big challenge for us, even in like the slower time of the nail salon. And one of our biggest findings now in doing this follow-up is that people are actually really, really interested in the data. And it's really important for us to be able to provide the data to them in a language that they understand. It's something that we are finding now through our final follow-up interviews that people are really, really excited to see. And so we're really excited to share this research with you all, and then also to our community. And I will pass it back to Dr. Huynh to continue.
Thank you, Emily. As Emily has mentioned, basically, this is a pilot project, and so we have it took us a very long time just to do the recruitment, and we only have 3 months follow-up. But during that time, we had a chance to check in with a lot of our participants, which gave us a lot of new insights. So basically, the way we plan the project, phase 1, we have baseline data where we conduct health surveys and personal air quality monitoring and biological monitoring the urine samples. And then phase 2, we had the intervention delivery, which VietLead is leading. And also phase 3, we are finishing up the phase 3 so that we can kind of learn through the process of what's like doing this kind of intervention, community-based intervention. And it has been very labor intensive. We started the project even pre-COVID, before COVID, and it got delayed significantly. But during COVID, our community partner, so between spring to summer to 2020, we worked with VietLead bilingual community health consultant Jia to develop the training. One thing about Jia is that she is a former nail salon worker and still work part-time, and so she has a lot of knowledge about the industry as well as the practical day and day of nail salons. So it was very helpful for us to have her. She's truly an asset to our team. And then because of during COVID, we couldn't deliver the training, and so we tested online via Zoom. And then once things COVID sort of subsided, we then actually do the formal recruitment for the in-person pilot program. And right now we're wrapping up our project and planning our community meetings so that we can present the results back to our research participants. For the content, we basically use the OSHA Guide for Healthy Nail Salons content with our own modifications to make sure that it's linguistically and culturally appropriate, but also we need to do a lot of explaining and pictures because there's a lot of like difficult technical terms. It seems like a lot, so in the next iteration, we might do some modification as well. And like we said, I think we're gonna do a 3-month follow-up with this first cohort. And for some of the give back products from our research, for each salons, we did the training and provided them the materials. And we also did a recommendation report prepared by Drexel with consultation with Jinia, and then air quality reports. Interestingly, some of these things were things that we didn't anticipate or wrote in the grant that we would do. But as we work with our community partners and also learn more hear more from our community what they would like to see, we started to add all these components back, components in, even though it's like kind of it wasn't something that we budgeted our time and resources for, but it's something that we felt really important for other community and also help us build long-term connections with our research partners. And so here, like, because I'm an industrial hygienist by training, and so doing this air quality or like recommendation report is something within my wheelhouse. So this is something that we can do relatively quickly. So this is like a demographic of our research participants. We had 44 participants, and most of them are female. And also Vietnamese, and were born in Vietnam. Interestingly, we have a few who were born in the US, and so we have bilingual team delivering the intervention both also in English and also in Vietnamese. We enroll both owner and workers because we felt it's really important to have the owners buy in. And as expected, most of our participants indicated that they did not speak English very well, and so therefore prefer us to deliver the materials in Vietnamese. So we don't have time to go over the baseline. In fact, we're still in the process of analyzing the data. But throughout the 2 years that we've talked with our community, and also also during this project, we engaged in a lot of conversations to ask them what works and what worked and did not work, and also what are some of the benefits and barriers, so that this information would help us and mostly VietLead to plan for future, advocacy. So the two main perceived benefits of the program was that it's provided opportunity to learn new things and to protect the health. And we see a lot of need for such an outreach program in the Philadelphia area. And also some of the owners also see as a potential to attract customers and retain employees if their salon is formally recognized and known by the customers, and so this could potentially bring new income. We also documented, or many of the people expressed a lot of barriers, and some of these include poor availability of affordable, safe products and equipment, the cost of upgrading ventilation, and also maintenance, as some of the speakers yesterday talked about. If you actually running these things cost energy, and so you also have to budget in those kind of costs. Because nail salons tend to want to please customers, and so sometimes it might compromise the safety practices. One such example is maybe like cutting cuticle. And many salons workers express the need to have the owners to be on board, because even if the workers themselves, really like the program and agree to make some of these changes, the owner needs to be on board in order to make some of the larger changes, like changing out products or upgrading the ventilation system. From the owner's perspective, and also some workers too, that some of the organizational management practices may also affect employees' motivations to participate in the program. And also a lot of both the owners and workers expressed lack of engagement from our own Philadelphia local government to support workers in small immigrant-owned businesses. As Emily said, like during the impact of COVID is really large, and like trying to go back to pre-pandemic fellow will be very extremely difficult, and many, especially small immigrant-owned businesses, do not have the right information or support from, say, the local chamber of commerce. If you have access or member of that to really get the support that they need to be successful. For my concluding thoughts, as you can see, there are many challenges ahead of us because the systemic barriers, some of the barriers that I've just present are mostly systemic barriers. And so there's also many of them, and it's also a bit harder and challenging to address them. In our research, we try to apply the community's participatory research principles in our work, and I felt that it has substantially improves our working relationship with our community partners and also maximize our research impacts. One such example is that we engage our community partners and also like our community members through this process. As we conduct this research, the information is being processed and our community is learning and receiving the information as we carry out the research. And so that's why our community members are excited to learn about the results of the work that we're doing at the future community meetings. As researchers, we have limitation. We do not know a lot about community organizing or policy, or at least for me. And so I kept telling VietLead, I think really, I reached my limitation. We really need your help to advocate for local policy change to support the immigrant-owned businesses and also our nail salon communities. And lastly, I want to acknowledge the funding of this research is mostly coming from NIOSH, a Drexel internal pilot grant, and Dr. Arthur Frank for supporting supporting our research staff, and most importantly, our nail salon communities who participated in this research.